Snoring is not just a sound. It is a mechanical event happening inside the airway. When you fall asleep, the muscles of the throat relax. The airway becomes narrower. Air still tries to pass through, but now it moves through a smaller space. That airflow can make soft tissues vibrate. The soft palate can vibrate. The tongue can fall backward. The walls of the throat can move. And that vibration is what we hear as snoring. So, the first important point is this. Snoring is usually not the disease itself. It is a sign that airflow is becoming unstable during sleep. For some people, that airflow is only noisy. For others, the airway may become partially or completely blocked. That is where snoring becomes medically important. Simple snoring, sometimes called primary snoring, means a person snores but does not have obstructive sleep apnea. Obstructive sleep apnea is different. In sleep apnea, breathing repeatedly slows down or stops during sleep. Oxygen can drop. The brain may briefly wake the body up to reopen the airway. The person may not remember these awakenings, but the body does. This is why loud snoring with pauses in breathing, gasping, choking, morning headaches, high blood pressure, or daytime sleepiness should not be treated as just an annoying noise. It may need a sleep evaluation. A snoring app, a smartwatch, or a microphone can sometimes detect snoring sounds. But these tools are screening tools, not final diagnostic tools. They can confuse your snoring with a bed partner, background noise, or other breathing sounds. And many consumer devices have not been validated well enough to diagnose sleep apnea. Now let's look at what may actually help reduce snoring. The first group is not really a device, but it matters. Weight, alcohol, smoking, nasal obstruction, and sleeping position can all influence snoring. Alcohol relaxes the muscles of the throat. That can make the airway more collapsible. Sleeping on the back can also make snoring worse in some people because gravity pulls the tongue and soft tissues backward. So for people who snore mainly on their back, positional therapy may help. This can be as simple as devices that discourage back sleeping, or newer devices that detect body position and vibrate when the person rolls onto the back. This is not a universal solution. It works best when the snoring is clearly position-dependent. If someone snores just as much on their side as on their back, positional therapy is less likely to be the main answer. The second category is nasal devices. These include nasal strips and internal or external nasal dilators. They are designed to improve airflow through the nose. The important detail is that they do not directly treat vibration in the throat. They may help when nasal blockage is contributing to mouth breathing or increased airway resistance. So if the problem is a narrow nasal valve, congestion, allergic rhinitis, or poor nasal airflow, a nasal dilator may reduce snoring in some people. But if the main vibration is coming from the soft palate, tongue base, or throat, a nasal strip alone may not do much. And nasal strips should not be considered a treatment for obstructive sleep apnea. The third category has stronger evidence for primary snoring, mandibular advancement devices. These are oral appliances worn during sleep. They move the lower jaw slightly forward. When the jaw moves forward, the tongue is pulled forward as well. This can widen the space behind the tongue and reduce the collapse of the upper airway. It can also change tension in the soft palate and reduce tissue vibration. But there is an important condition. The best supported devices are usually custom-fitted and adjusted by trained dental and sleep professionals. The fourth device is CPAP. CPAP stands for Continuous Positive Airway Pressure. It uses air pressure through a mask to keep the airway open during sleep. For obstructive sleep apnea, CPAP is one of the most established treatments. It can also reduce or eliminate snoring because the airway is being held open. But for primary snoring alone, CPAP is usually not the first thing people want to try. It can be effective, but adherence is variable because some people find the mask, air pressure, or machine uncomfortable. The fifth category is myofunctional therapy. This means exercises for the tongue, soft palate, and throat muscles. The idea is simple. If weak or poorly coordinated upper airway muscles contribute to snoring, training those muscles may reduce vibration and collapse. This is plausible, and there is some evidence that structured exercises can reduce snoring in certain groups. But the practical problem is adherence. Exercises have to be done correctly, repeatedly, and for weeks or months. Some newer products try to make this easier, such as devices that turn tongue and throat exercises. There are also newer electrical stimulation devices designed to activate airway muscles during sleep. Some early studies suggest that stimulating tongue-related muscles may improve airway space or reduce snoring in selected patients with sleep-disordered breathing. But for the average person searching for a snoring device online, this should still be considered a developing area, not a guaranteed solution. So the real answer is not which anti-snoring device is best. The better question is, where is the obstruction or vibration coming from? If the main problem is nasal airflow, nasal dilators or treating nasal obstruction may help. If the snoring is worse on the back, positional therapy may help. If the tongue and jaw position are narrowing the airway, a mandibular advancement device may help. If sleep apnea is present, CPAP or another sleep apnea-specific treatment may be needed. If muscle tone is part of the problem, structured myofunctional therapy may help, but it requires consistency. And if a device promises to stop all snoring for everyone, that is not how the biology works. Consumer apps may help you notice a pattern, but they should not replace a medical evaluation when sleep apnea is suspected.